CVA code, we're then getting monies for another CVA. When in reality, what we want is either the history of for 2013, or we would like that residual effects if those are there. The third tip I have is unspecified coding. The example I'm using here is kidney disease. Oftentimes when our coding analysts are looking, we see that the patient has kidney disease, but we don't have the specific type in the code. So is it acute? Is it chronic? Is it stage 3? All of those things are found in documentation, and we just ask that the providers also link that documentation with the codes that they pick. Oftentimes we see on problem lists where there's like 4 different types of kidney disease coded for a patient, and all of the notes have shown that it's stage 3 the whole time. So as April was saying earlier, CMS assess, pays, and adjust based off of the diagnosis codes that are reported in the hierarchical condition categories. This is an annual process, so CMS really resets every January 1. Patients no longer have those conditions on their records as far as risk adjustment is concerned. So it's up to our participating provider groups to report these codes at least once a year. We tend to offer, the preventive visit or that wellness visit offered by Medicare as a good time to take inventory. We also have nurse practitioners at Health Alliance that will go into a member's home if they aren't getting into the provider, just to do a health risk assessment to make sure that those diseases are being seen at least once a year. So if the providers don't code it, then CMS doesn't recognize that the patient has those conditions, which we know in most cases is not true. Another aspect of documentation that I'd like to talk to you guys about is risk adjustment data validation. So on the provider side, you have OIG coming in and doing audits. Levels of service are looked at a lot on the CPT side. What we have is Medicare coming in and looking at the validation of the diagnosis codes that they receive on claims and through the RAPs on the back end from our coding analyst. So in Medicare Advantage currently, we are going through and looking at the documentation, validating codes, and also adding codes if they're not on the initial claim. But Medicare does conduct these audits currently with Medicare Advantage. And what they're going to start doing, we got word, is they're going to start extrapolating. So if there are errors in the review findings that they have, they will extrapolate it across the health plan. And this is starting with dates of service 2010. So really there's nothing we can do about it at this point for those claims up to 2013. But we're really putting in some good initiatives to try to make it better for the future. As far as commercial risk adjustment, data validation, it's a little bit different. What we're finding from the government is the health plan is going to be in charge of hiring a data validation audit company and providing them with the information, and then they will in turn provide the information to CMS. So really the risk stays with us, but it's out of our hands as far as the audits. So we're probably going to be incorporating more efforts there to have our audits. We're going to have the data validation company's audits, and then of course CMS will do their piece. As far as Medicaid,